Welcome back to Silver Vitality Vault, your premier destination for evidence-based health advocacy and longevity strategies specifically curated for the modern senior. Today, we are opening the vault to a disturbing reality that is currently unfolding in medicine cabinets across the globe. Millions of older adults are dutifully taking daily medications that could be silently and systematically destroying their hearts. The most shocking aspect of this crisis is that we aren't discussing illegal substances or experimental back-alley treatments. We are talking about common FDA-approved drugs that are prescribed by well-meaning physicians every single day. A growing vanguard of cardiac surgeons and cardiologists is now sounding a desperate alarm. They are witnessing consistent, undeniable patterns in their operating rooms that can no longer be ignored. Hearts that should be relatively robust for a patient's age are instead showing structural damage that seems physiologically impossible. Inflammation markers in these patients are through the roof. Heart muscles are thinning and weakening, and dangerous rhythm disturbances are appearing out of nowhere. When these surgeons trace back the medical histories of these patients, they keep finding the same pharmaceutical culprits over and over again. Research from elite institutions like the Cleveland Clinic, Johns Hopkins, and the European Society of Cardiology is finally confirming what these surgeons have seen firsthand. Certain medications taken by seniors are causing documented, measurable heart damage. We aren't talking about rare, one-in-a-million side effects. We are talking about cardiovascular risks that affect substantial percentages of users, some increasing heart attack risk by over 40%, while others triple the chance of developing fatal arrhythmias. But there is one drug on this list that stands above all others, a medication cardiac surgeons are now labeling the silent heart killer. Before we reveal that number one threat, let me walk you through the full list so you can understand the complete picture of what could be compromising your cardiovascular health right now. Before we begin, please let us know in the comments your age and where you are watching from. We at Silver Vitality Vault read and reply to every single member of our community. Now let us begin with number 7. Number 7, the long-term acid trap, proton pump inhibitors. You likely know these medications by their household brand names, Prilosec, Nexium, and Prevacid. Proton pump inhibitors, or PPIs, are among the most frequently prescribed drugs on the planet. They function by shutting down the acid-producing pumps in your stomach lining to treat reflux and ulcers. While they are a miracle for short-term relief, millions of seniors have remained on them for years or even decades, and the cardiac bill is finally coming due. A landmark study published in the journal PLOS One analyzed data from nearly 3 million patients and found that PPI users had a 16 to 21% increased risk of heart attack compared to those who didn't take the drugs. The biological mechanism behind this is both fascinating and terrifying. PPIs appear to inhibit the production of nitric oxide in the endothelium, the delicate lining of your blood vessels. Nitric oxide is the lifeblood of cardiovascular health. It keeps your arteries flexible, prevents the formation of dangerous clots, and shields the heart from inflammation. When your nitric oxide levels are suppressed by PPIs, your arteries become stiff and brittle, blood pressure climbs, and the risk of a catastrophic event spikes. For seniors with existing coronary artery disease, Stanford University found that long-term PPI use was associated with a doubled risk of cardiovascular mortality. The Silver Vitality Vault Protocol. If you suffer from reflux, discuss H2 blockers like famotidine, Pepcid with your doctor, as they do not appear to carry the same nitric oxide stripping risks. Additionally, lifestyle interventions, such as losing excess weight, elevating the head of your bed by 6 inches, and avoiding food 3 hours before sleep, can often eliminate the need for these heart-straining medications entirely. Number 6, the antibiotic ambush, fluoroquinolones. This entry often catches people completely off guard. Antibiotics are life-saving tools, but a specific class known as fluoroquinolones, including Cipro, Levaquin, and Avelox, has been conclusively linked to severe heart and aortic issues in seniors. A major study in the Journal of the American College of Cardiology found that the use of these drugs was associated with a 66% increased risk of an aortic aneurysm or dissection, a localized bulge or a life-threatening tear in the body's main artery. This risk can persist for up to 60 days after you stop taking the pills. Beyond arterial integrity, these antibiotics can trigger QT prolongation, a disruption of the heart's electrical timing that can lead to a fatal arrhythmia known as torsades de pointes. The FDA has issued multiple warnings, recommending that these drugs only be used for severe infections where no other options exist. For common issues like simple UTIs or sinus infections, older and safer antibiotics like amoxicillin or nitrofurantoin are usually just as effective without the cardiac gamble. Number 5. The over-the-counter threat. NSAIDs. Non-steroidal anti-inflammatory drugs, or NSAIDs, are in almost every home. Ibuprofen, Advil, Motrin, naproxen, Aleve, and celecoxib, Celebrex are the go-to solutions for arthritis pain. However, for older adults who take them chronically, the cardiac consequences are devastating. A meta-analysis in The Lancet involving over 350,000 patients revealed that high-dose NSAID use increased major cardiovascular events by 1/3. Specifically, ibuprofen increased heart attack risk by 44%. These drugs function by blocking enzymes called COX-1 and COX-2. While this stops pain, it also blocks prostaglandins that protect your blood vessels and heart. Furthermore, NSAIDs cause the body to retain sodium and fluid, which spikes blood pressure and places a massive workload on an aging heart. Even short-term use, less than 1 week, has been shown to increase risk in vulnerable seniors. At Silver Vitality Vault, we recommend exploring topical NSAID creams, which deliver far less of the drug into your bloodstream, or utilizing physical therapy and weight management to reduce the need for systemic pain relief. Number 4. The diabetes dilemma, sulfonylureas. Diabetes already doubles your risk of heart disease, which makes the choice of medication absolutely critical. Not all diabetes drugs are heart neutral. Older classes of drugs, specifically sulfonylureas like glyburide, glipizide, and glimepiride, have been under intense medical scrutiny. A major study in Circulation followed 250,000 diabetic patients and found that sulfonylurea use was associated with a 20% increased risk of cardiovascular death compared to metformin. These drugs force the pancreas to pump out more insulin, which can lead to hypoglycemia, dangerously low blood sugar. These sugar crashes trigger a surge of stress hormones that are incredibly taxing on the heart muscle. Conversely, newer classes of drugs like SGLT2 inhibitors, Jardifarxiga, have been shown to actually protect the heart and reduce the risk of heart failure. If you are a senior taking an older diabetes medication, it is vital to have a heart-focused conversation with your physician about modern alternatives. Number 3. The sleeping pill stall, Z-drugs and benzos. Insomnia is a plague for seniors, but the pharmaceutical fix may be worse than the fatigue. Drugs like Sonata, and Lunesta, as well as benzodiazepines like Valium or Xanax, have been linked to serious cardiovascular mortality. A study in BMJ Open found that these hypnotic sleep aids were associated with a 4.5 times greater risk of death. One primary reason is that these drugs suppress your respiratory drive, significantly worsening sleep apnea. Sleep apnea is a well-known driver of high blood pressure, atrial fibrillation, and stroke. By quieting your breathing at night, these pills indirectly starve your heart of oxygen during the hours it needs to recover most. The Silver Vitality Vault Protocol. Consider cognitive behavioral therapy for insomnia, CBTI, which clinical trials prove is more effective than pills for long-term sleep. If you need a supplement, low-dose melatonin is significantly safer for your heart than prescription sedatives. Number 2. The cognitive cost, antipsychotics. Antipsychotic medications, like risperidone, Seroquel, and Haldol, are frequently prescribed to seniors to manage agitation or behavioral issues associated with dementia. However, cardiac surgeons are seeing a massive death toll associated with these drugs. The New England Journal of Medicine found that elderly patients taking these medications had double the risk of death, primarily from sudden cardiac causes. These drugs cause metabolic changes, weight gain, and QT prolongation of the heart's rhythm. Perhaps most dangerous is their ability to block alpha-adrenergic receptors, causing a sudden drop in blood pressure when you stand up, leading to fainting, falls, and cardiac stress. The FDA has issued a black box warning regarding the use of these drugs in dementia patients. At Silver Vitality Vault, we urge families to look for underlying causes of agitation, like undiagnosed pain or UTIs, before resorting to these heavy-duty cardiac disruptors. Number 1. The silent heart killer, prescription opioids. We have reached the most dangerous drug on our list. According to the cardiac surgeons we interviewed, prescription opioids such as oxycodone, hydrocodone, morphine, fentanyl, and tramadol represent the single greatest pharmaceutical threat to the senior heart. A massive study in the Journal of the American Heart Association involving over 575,000 seniors found that long-term opioid use was associated with a 65% increased risk of cardiovascular death. Initiation of these drugs more than doubles the risk of a heart attack or stroke within the first 30 days of use. Opioids cause profound respiratory depression, leading to chronically low oxygen levels in the blood. This chronic hypoxia triggers a storm of inflammation and oxidative stress that damages the structural walls of the heart and blood vessels. Long-term use has been shown to physically alter the heart's anatomy, causing changes that mimic the early stages of heart failure. Furthermore, opioids disrupt the autonomic nervous system, the system that controls your heart rate and blood pressure, making the heart less resilient to stress. The interaction between opioids and other common senior drugs, like blood pressure meds or benzodiazepines, creates a lethal cocktail that suppresses heart function to dangerous levels. The Silver Vitality Vault Promise. The cardiac surgeons sounding this alarm aren't telling you to throw away your medications in a panic. What they are urging is an informed, courageous conversation with your healthcare provider. Many of these medications were prescribed when their cardiac risks weren't fully understood, but the research has evolved, and you deserve to know what that science shows. The heart damage from these medications is often preventable, but prevention requires awareness and the willingness to explore safer alternatives. At Silver Vitality Vault, we want to know, are you planning to discuss these findings with your doctor? What is holding you back from having that conversation? Please share your experiences and opinions in the comments below. Your story might be the very thing that helps another member of our community protect their heart. Don't forget to like this video, subscribe to Silver Vitality Vault, and share this with the people you love. Your heart is the engine of your life. Let's keep it running strong. Thank you for watching, and we will see you in the next video.